Thank you, Mr. Speaker. We do have a committee substitute that I would move adoption.
Clerk, please report.
House Committee Substitute 1 to House Bill 423.
Lady from Kenton.
Mr. Speaker, the House Committee Substitute simply corrects a drafting oversight, amending KRS 205-536 to clarify that prior authorization exemption program requirements do not apply to Medicaid. I move adoption.
Motion is for the adoption of House Committee Substitute 1. Is there any discussion of the committee substitute? Seeing none, those in favor signify by voting aye. Those opposed, nay. House Committee Substitute 1 is adopted. Lady from Kenton.
Thank you, Mr. Speaker. Prior authorization is a layer of bureaucracy. It was originally intended to control cost by insurers, but it slows care to patients as providers must ask permission to approve care that providers know patients need. 423 is all about cutting red tape. It guarantees greater transparency and it ensures that healthcare providers can focus on patient care and less on the bureaucratic barriers to care. In streamlining the prior authorization process, we are making it easier for Kentuckians to get the treatment that they need without unnecessary delays waiting for approval from insurance companies. This agreed-upon language with insurers is the product of 4 years of work with all of the insurance providers, all stakeholders and providers, healthcare providers, including behavioral health providers. House Bill 423 creates a framework for insurers to establish a gold carding or a waiver program, an exemption from prior authorization if they meet certain qualifications. Participating providers are only exempt if they meet allowable conditions, and it's only for specific conditions. It exempts prescription drugs, which we did want to include, but for right now, insurers are uncertain that they can operationalize that and are actually, this is permissive, and so it would allow insurers to include that later if they would choose to do that. Insurers would set the terms of the exemption program within the parameters of this bill. It establishes mandatory and permitted provisions and conditions of the exemption program. It prohibits retrospective reviews based solely on a provider having an exemption, and it requires the Commissioner of the Department of Education to submit an annual report that includes information about prior authorization exemption programs and prior authorizations conducted by private insurers. Although this program does not apply to Medicaid, it does require the Commissioner of DMS to submit an annual report that includes information about prior authorizations being conducted under the provisions of Medicaid services. Mr. Speaker, if there are no questions, I move passage of House Bill 423 as amended by the House Committee Substitute.